And then the second avoidable factor is alcohol intake. Alcohol is associated with mouth, pharynx, liver, colorectal, that is cancer of the colon and cancer of the rectum, as well as breast cancer. Now, the way alcohol increases the risk of cancer are several, about 3 or 4 of them. The first one is that it breaks down, the main ingredient in alcohol is called ethanol. It breaks it down to a substance called acetaldehyde, which is a toxic carcinogen, meaning it's a very strong chemical that can cause cancer. So by breaking it down into that ethanol, it can go and damage the DNA and the cells. The second one is that it generates chemically reactive molecules, that is substances in the body that contain oxygen that can go and damage the DNA directly. A third one is that it stops the body from metabolizing some nutrients such as vitamin A and vitamin B. And these are the vitamins that are associated with protection against cancer. So by preventing these nutrients from doing their work, the risk of cancer is increased. Another risk factor is obesity. Obesity is associated with the risk of cancers of the esophagus, the breast, the endometrium, which is the uterus, the colon, the pancreas, the kidney, the thyroid, and the gallbladder. It also causes its own effects by several factors. One of the most important one is that obesity is somebody being extremely overweight. There are different classes of being a normal size. You have, when we use what we call the body mass index, you have particular numbers that tell you what level you fall in. There is a normal weight for age and height of an individual. When you have passed, it's a range. When a person has passed that range, it can either be the person is overweight, which means just a little bit over the expected range, and then obesity. Obesity is when you have even exceeded that particular number. Then you have morbid obesity. That one has become even a disease on its own. So any form of obesity is a risk for developing cancer because the fat cells contribute to an increase in the circulating hormones in the body. Hormones are chemical substances that have specific functions in the body that allows different functions to occur in the body. Now, obesity increases the risk of insulin, which is a hormone that regulates the way sugar is used in our body, and then estrogens. Estrogens is, usually we call it female hormones. It's one of the the most significant hormones that we have as women that regulates our reproductive cycle. So what it does is that it produces high levels of these hormones, and they now go to affect the DNA, leading to those kind of cancers, especially with estrogens, breast cancer, and the cancer of the uterus. Then another effect is that the fat cells themselves can have indirect effects by affecting those substances in the body that regulate the tumors. It has been suggested that eating a healthy diet and being physically active may help reduce the incidence of cancer. The other group is the biological carcinogens. These ones are infectious agents, and they are also responsible for about 22% of cancers in the developing world. The difference is that in developed world, you have more of physical and chemical agents. For us, it is the infections. Why? Is because they have sorted out how to deal with their infections. Two main classes, bacteria and viruses. The most common viruses that are associated with cancer are hepatitis B and hepatitis C. These are viruses that go and affect the liver. So they are responsible for development of cancer of the liver. Then the other virus is called human papilloma virus. That one is responsible for over 90% of cases of cervical cancer. And why they have been able to reduce their incidence of this type of cancers is because they have organized screening programs as well as vaccination that protects them from developing these viruses and bacteria. These viruses, rather. The bacteria that is actually implicated, I'm sorry, I didn't put it here. It's a very funny name. It's called Helicobacter pylori. Maybe that's why I didn't write it. That is associated with stomach cancers. People who have peptic ulcer may have this kind of bacteria in the lining of their stomachs and their intestines. So there is a risk of developing stomach cancer in those kind of patients who have that. Now, this is the genetic aspect. For us to understand how these factors act, we need to understand how the genetic aspect works. Now, the interaction of the genetic makeup of an individual with the carcinogens, that is those agents I've just finished calling, is what actually leads to cancer. Genes are found in the DNA of each cell of the body, and these genes control how the cell functions and how quickly it grows and how long it will die or live. Now, the cancer begins when one or more genes in the cells are changed or mutated. Now, the mutation means a change in the DNA. Now, the normal processes such as cell death that should occur fail to do so. So when there's a damage, like I said, it fails to occur, and then this leads to an abnormal and rapid growth of the cell into a tumor. Now, this is why it is usually seen in old age. It takes many years for it to occur because you have different mutations. As you can imagine, if a person is smoking for a lot of years, that amount of smoke he takes will go and damage one cell. But what happens is that the body is able to control that. So when there's a mutation, the body takes it out and kills it. But then one day, that process stops. So what happens is because it occurs over a lifespan, that is why you have it occurring mostly in old age. And that's why old age is associated with cancer. Okay, this is another diagram that shows the way the mutation occurs and how the cancer can occur. There are two types of genes that can cause the cancer. You have the acquired gene mutations and you have the hereditary gene mutations. Now, the acquired gene mutations are what is responsible for most of the cancers that occur. And they occur from damage to genes from those external agents, and they are usually not passed from parent to child. So these ones are not inherited, they're acquired. They turn a healthy cell into a cancerous cell, and these genes that do that are called oncogenes. You have examples of them. You have those that this one is called HER2 gene. It's the protein that controls, by nature, what it does, it's supposed to control cancer growth, the growth of cells. So when this particular gene is affected, that growth stops and then it develops into cancer. Okay, this is also another one. You have the first. Now this is the cancer cell. This is a group of cells. Most of them are normal. Then you have this one here that is abnormal. It has gone through the first mutation. After some time, it undergoes a second mutation, and you now see a couple of more cells growing. Then it undergoes a third one and a fourth one until it now creates a mass of malignant cells that becomes a tumor. The inherited ones are called germline mutations, and these only make up about 5 to 10% of all cancers. The most commonly inherited genes are called BRCA1 and BRCA2. We call it BRCA1 and BRCA2. These two genes, when a person has it, increases the risk of hereditary breast and ovarian cancer, especially with BRCA2 gene. If a person has BRCA2 gene, she has a 40% chance of developing breast cancer, and then about 20% chance of developing ovarian cancer. And this is what has informed genetic testing for individuals that will now go ahead and do some kind of protective surgery. A famous one is this actress, what's her name? Angelina Jolie. She discovered that she had this BRCA, either 1 or BRCA2 gene, and she went voluntarily and had a double mastectomy. She removed both her breasts to prevent herself from catching cancer. Is that serious? Then that's all that. Well, some people don't need it. Then the other one that can be inherited is, okay, no, the P53 gene is an acquired one that causes a lot of cancers. So these are the ones that actually allow the genes to be mutated and lead to cancer. So let's go to the types of common cancers that we have. Like I said, cancers can occur in every part of the body, from the head to the toes. But the frequency of cancer varies according to geographical locations and sex and age. Worldwide, in 2012, the most common cancers were, for men, were lung cancer, prostate cancer, colorectal cancer, stomach and liver cancer. For women, the commonest were breast cancer, colorectal, lung, cervix, and stomach cancer. However, for us in West Africa, the top 5 cancers were breast, cervix, prostate, liver, and colorectal. This is a diagram showing the most common cancers worldwide, like I've just said. Then I just want to say something about childhood cancers. Now, childhood cancers are cancers that arise in children that are less than 15 years old. After 15 years, they're considered adults. Now, these childhood cancers are rare compared to adult cancers, but they do occur. And the pattern of the cancers differs significantly compared to adults. And when we look at the kind of cancers we see in children, the most common ones are the cancers that affect rapidly growing, naturally you have rapidly growing cells like the skin, blood cells, and so on. Those are the ones that grow very rapidly naturally. And in children, those are the cancers that usually affect them. In general, 1/3 of all childhood tumors are leukemias, that is blood cancers. But then you have other common cancers which include lymphoma. Lymphoma is, we have something called the lymph nodes. You know, when a person has an infection, like it has a cold or a wound, I don't know, in Hausa we call it kalulua. Now that's the part, what the kalulua is, that lymph node, it's an organ somewhere that takes water in and out from the body. So when there's an infection, that place becomes blocked and then the place becomes swollen in different parts of the body. Now, cancer can develop in those things, and you commonly see it in children, and it's called lymphoma. And then you commonly see cancers of the brain, of the central nervous system in children. The cancers of the lungs, breast, colon, and rectum are infrequently seen in children. Usually, you don't see them as much in children. Now, the common tumors you get in children are called, one is neuroblastoma, that is one inside the kidney. Neuroblastoma is nerves, is on the nerves. Nephroblastoma is the kidney. Medulloblastoma is in the brain. And then retinoblastoma is in the eye. These are the common ones that we find in children apart from leukemias and lymphomas. Now, symptoms and signs. This is extremely important because when you know, like I said, early detection and prevention is the best way of dealing with cancer. So if you have an idea of what the symptoms and signs are, then you are likely to be able to present early for treatment. So it's important that we know. Now the symptoms are complaints that an individual will make to a doctor. For example, doctor, I have a headache, that is a symptom. A sign is what I as a doctor will examine and say I have found. Like if I find a swelling, that is a sign. But if you tell me that I have a swelling, it is a symptom. So we need to understand that. So the signs, the symptoms of cancer depend on the type of cancer, where it is located, how long it has stayed, and the stage of the disease. In early stages of the disease, you may not find any symptoms, especially for small organs. Typical example is cancer of the ovary. The ovary is a very tiny organ in the body that is swimming somewhere else, swimming in the abdomen, that may not present at all until it has become very big, and by that time it has gone into the late stage. Even in developed countries, presentation of ovarian cancer comes at the late stages. But you have organs like in cancer of the uterus. One of the first signs of cancer there is abnormal bleeding. So the person is able to catch it on time. So it depends on where the cancer is actually before we get the symptoms. Usually at late stages, when other organs are involved, you have symptoms like weight loss, extreme fatigue, and this is because cancer cells use up the energy of the body, and they can also consume the immune system such that the body can produce this kind of reactions. Generally speaking, the signs of cancer, the symptoms of cancer can include unexplained weight loss, fever, and not just ordinary fever that keeps on coming and going for a very long time, fatigue, pain, and then skin changes. These are not limited, these are just generally. Then the other symptoms will depend on where the cancer is. For example, if the cancer is in the bowel, or in the stomach, or in the intestine, like colorectal cancer, but a person can present with change in bowel habits, either constipation or diarrhea, blood in the stool, and if it is for a cancer of the bladder, they can have blood in the urine. But the important thing is, once a symptom that is abnormal presents, you need to be able to go and get checked. You can make sure it is fine. Then the other thing is for signs. Like breast cancer, you can have there may be swellings on the breast, ulcerations, or discharge from the nipple. For cancers of the cervix, there can be abnormal bleeding from the vagina, things like that. So it depends on where the cancer is. Then the signs of the cancer also depend on depends on where the organs are. Typically, if a person has cancer, there are ways in which a doctor can suspect by examining a swelling. If you have a swelling that is soft and is not very painful, you can move it about. When you touch it, it's unlikely to be a cancerous tumor. But when you do an examination and it is very hard, like a stone, or it is painful and you can't move it, it suggests that it has cancer. Now this, like I said, these signs are detected by doctors. So it's not as if when you find some swelling on your body, you now think the thing has become cancer. It's not like that. The doctor is going to be the one to likely know what kind of tumor it is. And just for the record, there are a lot of tumors or swellings in the breast that are not cancerous. I've met women who have asked me that they're having pain in their breast, and automatically they think that they have cancer. The thing with breast cancer is that it can present in different ways. But the most important thing is, once you find an abnormal finding in the breast, just go straight to your doctor to check it. But do not assume that everything you find is cancer. Pain on the breast, some people have pain around their menstrual cycle, and that is usually because of hormonal changes around that time of the menstrual cycle. Most young girls, at one point or another, a significant number of girls have what we call a fibroadenoma, a very tiny tumor that will be moving around in the breast. Usually those tumors are not cancerous either. Then a woman who is breastfeeding can have breast engorgement because she has not breastfed properly, and the breast becomes hard like a stone. By the time she expresses the milk, the breast comes back normal, so you won't call that cancer. But those kind of changes can also occur that the person can now start thinking it is cancer. So we should be aware of that. Now, apart from checking what the symptoms are, what the examiner does is to determine the spread and the extent of the disease at the time of presentation. This will help determine the appropriate treatment to be given for that patient, so that with the aim of achieving cure. Cancers are usually divided into 4 for the benefit of categorizing the stage of the disease and knowing the treatment and knowing the prognosis. Stage 1 usually is the earliest stage and has the best prognosis. In most cases, you can achieve cure when a patient comes with stage 1 cancer. Stage 4 is the worst prognosis. It has at stage 4, it means you have metastasis. Am I the one that is doing that when I shake my hand? Okay, I will try. Which means most of the some other organs have been affected, and that has usually the worst prognosis, and a lot of patients will die at that particular. I didn't shake it this time. Saying at early stages there's a high chance of cure because the cancer is at the particular organ that it starts from. For example, I always use breast cancer because it's the commonest, and that's what I'm actually involved in. You can have breast cancer can start with a small tumor that is as small as a grain. At that particular time, if you catch breast cancer, you may not even have to cut off the breast. All you need to do is remove that particular tumor, give the woman some chemotherapy, and she has achieved cure. That is how important it is to to diagnose it at an early stage. But by the time you get to stage 4, when other organs are involved, you are not looking for cure. You are just looking to make the person's life comfortable, because survival at that point is short-lived. Next. Now let me try and move this. Now this diagram shows the stages of cancer. Here, at this point, now this is a pictorial diagram of how the body organ looks like. This is the substance of the organ. Here you have like the skin, the two superficial layers of the organ, the skin, the subcutaneous tissue, and so on. Now you have the mutation of the cell here. Stage A, it has invaded the top part of that particular organ. It hasn't gone beyond that limit. Stage B, it has started going into this second layer here. So these two stages, A and B, are early stage. At this particular point, stage A, you may not feel anything, but at stage B, you may feel a lump as a tumor. Stage C, here it has gone a little bit bigger and has invaded this part that is below. But for stage C, it has gone beyond the level of that particular organ. So this is just a pictorial diagram of it. Now then, next is the diagnosis. The diagnosis is made usually from a combination of the symptoms and the signs, and then investigations. And the investigations, that's the test that should be appropriate to confirm the diagnosis. It's important to understand that a diagnosis of cancer cannot be made until we have a tissue, a sample of that particular tissue that is affected, that has been examined by a specialist called a pathologist. What we do is we do a biopsy, meaning we remove part of that organ and examine it under a microscope. There are specific features of the cells that tells us this is cancer and this is not cancer. So unless you do that, you cannot make a definitive diagnosis of cancer, which is why if a patient comes to the hospital and cancer is suspected, some form of a surgical procedure is done. For example, if it is the breast, the lump is removed, or part of the tissue around the breast is removed and tested. If it is suspected cancer of the stomach or the ovary, an operation has to be done to get the sample. But by that time, we would have already made a diagnosis based on symptoms and then imaging techniques that tells us this is cancer. But the definitive diagnosis will come when an operation has been done and the tissue is taken out. So in those cases, usually, the treatment is done at the same time as diagnosis. For example, a woman has ovarian cancer. What we do is we would have done the symptoms and signs. When we do the tests like CT scans, a CT scan will tell you this is cancer based on the features that you see. So we plan a woman for what we call staging surgery, meaning we're going to treat the woman for the cancer as well as take a sample to give us a definitive diagnosis. In developed countries, what is done is you now take, while the operation is going on, they take a sample and they send it to the pathology lab called the frozen section, and you wait on the table. 10 minutes, 20 minutes, they come back, it's cancer. Then you know the extent of the surgery you're going to do. If it's not cancer, you know the extent that you're going to do. So that is the beauty of being in those kind of countries. We'll get there one day. Well, what obtains for us here, most of the time our patients have cancer. We don't really have that problem because most of our patients will come presenting late. So automatically, and in most cases, we can't even operate because they are too sick for us to operate. So that's another thing. So some of them, we might have to give them chemotherapy to reduce the bulk of the tumor before we are able to go in. And even that, it's very complicated, but basically that's what we do. You have to get a biopsy to get a definitive diagnosis. Now, other investigations that are done to confirm the diagnosis include the CT scan, the ultrasound scan, blood tests. Now, the blood tests we have to do, now, because we are thinking it's cancer, we have to make sure that the other organs too haven't been affected. So that is why we will ask a patient to have chest x-ray. Lungs are one of the commonest places where cancer metastasizes to. So you will do a chest x-ray, you will do ultrasound scan to check the other abdominal organs, blood tests to check the liver function, the kidneys, the function of the kidneys, and then you also do tests to check for specific substances that help you monitor the patient while you are doing the treatment. For example, there's a substance called CA125. When it is very high, in hundreds of thousands, for example, you know that this person has cancer. So you keep the value down, and then as you are treating the patient, you are repeating that test. It helps you to prognosticate or to say whether your treatment is actually working or not. So in addition to helping your diagnosis, it also helps you managing and monitoring the patients during treatment. Now, the treatment also depends on the type of cancer, the age of the patient, the health status of the patient, the personal characteristics of the individual, and the stage of the cancer. Stage 1 and stage 2, early stage, your aim is for cure. So anything you can do, you should do it. Because it means that at that particular point, once that woman or man is given that treatment, that cancer has gone. But even after that, she has to be monitored continuously because the cancer can come back. So we look at patients in terms of 5-year survival, how many of them have survived after this treatment for 5 years, and so on. For stage 3 and stage 4, you are not aiming for cure. What you are aiming for is to make the life of the patient better. So you treat as much as possible to reduce the cancer, and then to see that it does not reoccur as early as it would have if there was no treatment, or to reduce the progression, so to speak. So that is why we want people to understand how important it is to present early. And then there is no single treatment for cancer. There are different modalities, and in most cases, you cannot use just one kind of treatment for that particular cancer. Now, the modalities that are available include surgery, radiotherapy, chemotherapy, immunotherapy, or gene therapy. Now, surgery involves the surgical removal of the tumor. So you can remove it completely where you are aiming for cure, or you can remove part of it, which is called debulking, to allow you to treat the patient with other drugs. So for example, a woman comes with stage 4 ovarian cancer. The tumor is so big that you may not even be able to go to surgery immediately. You might have to give some drugs to reduce it. And then you go in and remove some of the tumor, and then treat the remaining tumor with chemotherapy or radiotherapy. Then you are able to achieve some kind of treatment for her. Now, radiotherapy, I've been saying radiotherapy. Radiotherapy uses radiation energy to treat cancer. So this one is a man-made energy that is used. And what is usually done is there's a particular machine that is made that directs that particular energy into the cancer, into the affected cancer cells. Most of the time, you have a combination of either surgery and radiotherapy or surgery and chemotherapy for the treatment of cancers. Chemotherapy is simple, chemo is chemical. So you are using drugs that are very potent, specifically made to treat cancer cells, to treat a woman or man with cancer. Now the problem with all these modalities of treatment is they all have their side effects. And one of the worst things about cancer is actually the side effects with the treatment. Because cancer occurs from normal cells becoming abnormal, the drugs, either chemotherapy or radiotherapy, has to act on even the normal cells for it to become, because it cannot differentiate between the good one and the bad one. So you just give the drug, so as it's affecting the cancer cell, it is also affecting the normal cells. But what happens is that the cancer cells are killed more than the normal cells. They are targeted at the cancer cells, but it affects the normal cells. And this is why you have a lot of side effects. You have hair loss, diarrhea, vomiting, weight loss, because even the normal cells are affected. This is one of the sad things about cancer. It's a very difficult situation, but so far that's the only thing that can be done. The side effects are very severe because of this reason. Then immuno or gene therapy, this one you use the immune system. You try to use the immune system to fight the tumor. It's only used in a few, not in all cancers, but just a few that have been found to work. Then hormone therapy is using hormones to actually treat the cancer. An example of that is for breast cancer and uterine cancer. Uterine cancer in early stages, very early stages, or even in late stages, there are particular hormones. I mentioned that estrogens are responsible for some of the cancers because they are increased in obesity. Now you have the other hormone called progesterone that has an opposite effect to estrogens. So you can now use those kind of hormones for treatment of some particular uterine cancers. And also you have some drugs called anti-estrogens. You can use that for the treatment of breast cancer and the like. Okay, I've just explained this. Now, another very important aspect. We're almost done. Prevention.